What happens when two of the most plugged in people in digital care team up to help you make sense of the chaos? Welcome to Control Plus Care. I'm Michelle.
And I'm Katie.
This is your weekly briefing on the most important digital care updates. We'll be unpacking what you need to know this week in under 30 minutes. But first, Katie, how are you?
Really good, thank you. Finally recovered from my relaxing canoe trip on Sunday, where I thought do a nice Sunday morning, take a picnic, go down the river, and it turned out into a very stressful 18-kilometer paddle. Not relaxing at all, but, would recommend in general for people who know more about canoes than I do.
I enjoy the optimism. You're like, see this river? We're definitely going to be able to have a picnic here.
Absolutely. I mean, I saw a kingfisher. That was quite nice. Have to take the small moments. And how about you? How are you?
I'm good. I'm still surviving summer holidays. Obviously, this week we are back in our respective homes.
I know, missing the in-person pod already.
And now we are going to have to find more reasons to do that because that was great.
Well, with conference season coming up, I think a variety of hotel rooms will be in our near future.
Premier in purple as far as the eye can see.
It's going to be very cohesive for September, October.
But anyway, that's not what we're here for today. Today, we are here to look at the news as it is this week, and it's been a busy one.
It has been. Every week this summer, I think we've had a conversation being like, oh, there surely won't be that much to talk about. Everybody's away. It's the school holidays. And yet,
it has been super, super busy. And we've even been impacted by our own news story this week.
we have, which, we don't always like to be in the news, but
Well, I mean, I say the news. We've not had anyone knocking on our doors to pick up the story, but I think it was something that happened that was definitely worth us talking about. So for those of you new to the audience, I run Better Security, Better Care, which is a big cyber resilience program for adult social care, and we provide resources and tools and support to help social care providers improve their cyber resilience. So I would say we're pretty enmeshed in the cyber world. We have a brilliant student called Deepak who's on placement with us at the moment doing some work with us, who is a technical cyber whiz, like really up to date. And this week he was almost phished. Not just phished, but phished in my name. So he received an email from Michelle Corrigan, which said, "Hi Deepak, urgent request, can we chat in 5 minutes?" Now, as anyone who has ever had one of those "can we have a chat" emails from a manager, like your instant reaction is like, "Ugh, go." Luckily, he's smarter than that, and he actually checked the email address, and it had come from quite a sophisticated mock-up version of an email, but it was still a Gmail. So he checked with Marta, who he works with, and was like, "This isn't Michelle, is it?" And I'm like, "No." So he spotted it straight away and then was able to go and have an actual look up the route into how this had been done. And it was a fairly sophisticated attempt, which very easily could have been a full attack.
I think the thing which really kind of blows my mind about this is often when we talk to people, I mean, everybody's received that email, right? It's like, oh, I need to have a chat, or oh, can you just click on this link? And normally we tell people, okay, well, check the email address. Are there any errors in it? Are there any mistakes? Hover your mouse over it and see if it is actually the email address it says it is. But this one, because it spoofed your email address so closely, just those basic checks wouldn't necessarily have made this clear to somebody. So I think it's an important one to realize that, cyber attacks phishing attempts are getting more sophisticated. And it could happen to anyone, really.
Well, then I was talking to one of our other colleagues and was saying, it was asking him to have a meeting. Like the second message that got sent to him was asking for his phone number. And I was like, what could have been the purpose? And our colleague was like, well, it very well could have been a deep fake because there's enough material online of me speaking that it'd be really easy to do a mock version of me on a call asking him to go and access something or send something that again just brings down those defenses.
Oh my God. I hadn't even considered about that because obviously there's a lot of recorded information about both of us online, but also things like the podcast, I guess, as well. But putting our voices out there more often. So increases the risk of that being possible for people.
Yeah. Like I was at a conference, a cyber conference not that long ago, and there was a professor who is from the University of Arizona, and he gave a demonstration and he said, all I need is this app that costs him $2 and a second phone. And he was able to, he used a colleague in his department. And he was able to do a version of his colleague on this and project it onto the big screen. And it was, it still has that little uncanny valley vibe. It still is a little bit jittery, but
Mm.
we've both had enough internet like connectivity failures that you could be like, oh, must have bad Wi-Fi.
Yeah, absolutely. Oh my goodness. I feel like I'm going to need to warn my parents and be like, if you get any weird sounding phone calls from me, I'll have a code word.
When they start with the podcast hook, it's not me.
Yeah, exactly.
All conversations are now started with an intro.
Yeah,
But
a nice pithy open and close. Oh, it is scary though.
Yeah.
And I do think, obviously, with running a cyber program, it's important to also share those messages that you can be prepared and training, but it's an ongoing preparedness. It's an always looking out for it. It's something we talk about a lot as a team. And I think we're going to have to keep having those conversations as things progress all of the time.
Yeah, I mean, that's the thing for me. Cyber resilience is not a job done. It is a culture, it is something that you adopt, and you are only as safe as that staff member who thinks to check. So yeah, so it was a very close to home. I felt really like it was very intrusive that they used my name.
Yeah,
Um and I'm so pleased that Deepak thought to do the check and nothing untoward happened, but near miss.
yeah, absolutely. Oh gosh, I bet Cyber Sam wasn't happy about this one.
Do you know what? I think he was both unhappy and happy because it gave him something to really get his teeth into. And we can guarantee we're all getting an email about things we need to be checking for very soon.
I assume he's going to be catching us out. I'm going to be every email. I'm going to be second guessing it. I'm like, is it Cyber Sam trying to get me?
I'm dreading when he rolls out the big fishing attempt because there's a really good chance he's going to pick something that you and I are definitely going to fall for.
Absolutely he is. If anyone hasn't listened to our episode with Cyber Sam, I would recommend picking that up. He's got lots of helpful hints and tips.
And we will have him on again in the future. He's brilliant.
Yeah, definitely. So the story that I picked this week is one that I actually spotted on LinkedIn. It was shared by Nell Thornton, who's from the Health Foundation, who does phenomenal pieces of research. I've talked about the research that the Health Foundation do a lot around sort of attitudes to AI. And she actually was on LBC on Sunday, and they were talking about the rollout of AI in health and care. I would recommend going and listening to the full clip. It's available online. But sort of what prompted the conversation was obviously the government focus on AI, the 10-year plan, and Chelsea and Westminster Hospital have been using AI to support doctors with completing paperwork for discharge summaries. And we know, obviously, getting people out of hospital is long been a core priority of things that we should be thinking about. And I thought it was a really interesting conversation because obviously the LBC host, whose name has completely escaped me right now, I'm very sorry, we'll put it in the show notes, raised questions about data privacy in the first place because it's using parts of the medical record to generate the discharge summary, which is then obviously checked over by a clinician. And Nell was really clear about the very clear safeguards that we have on how data is used in the NHS and also in social care. So from a data privacy perspective, really strict legislation in place. But what she raised, which I thought was something that we need to be thinking about a lot in social care as well, is that while it's great to see these pilots and the effectiveness of technology, these tend to happen in silos in like one location, particularly in hospitals where you see a lot of innovation or providers who've really focused on this. But there are quite a lot of concerns still about the lack of widespread adoption of this kind of technology. And so if there are significant benefits proven by pilots, how can we make sure that those benefits can be seen across the whole system, not just in one location? And really, there was a whole conversation then about the importance of having greater investment, not just in cutting edge technology like AI, but actually in the basics, thinking through, digital skills, basic connectivity, digital infrastructure, because we know quite often across the health and care system, quite often it's computer software which has let us down, having out of date computer systems And that's where a lot of those sort of risks can come from. And it's fine talking about AI all of the time. But if the reality is you're still a care home who can't get good quality internet into more than one room, AI feels a million miles away, right? That's not a realistic first step to take. So, how can we address some of those basic infrastructure concerns? And this is a little bit of a way for me to talk about a report which is not from this week, but it was published back in May, which the Health Foundation did and which Nell was talking about on LBC, which is they actually did some economic modelling about what it would cost the health and care system in terms of infrastructure upgrades over the next 5 years. And they modelled that it'd be £21 billion needs to be spent to achieve some of the technology commitments which would be made. And bear in mind, May, this is pre-10-year plan and all of that sort of thing. But I think it can be, and we do it as well on this podcast, right? We get excited about the big next step. Where are we going? But there is still so much to do in terms of bringing people on that journey in a way which is affordable and manageable and has those clear steps. So just a really interesting one.
I think it's that it's like the analogy of building a film set, isn't it? Like, we're going to build this lovely shiny facade of all these things that AI and frontier tech is capable of, but at the back it's cardboard boxes and, acro props. Like, nothing is real or meaningful unless we're getting those foundations right. And you and I have been part of a number of conversations recently about this ambition to fully digitize social care. And it has to start with those foundations. Connectivity is always one of our biggest questions. Ironically, one of the places where social care does better than health is that we don't have a lot of legacy tech. So health, for those that don't know, NHS trusts, NHS hospitals will have reams and reams of tech that is out of date without any meaningful way of getting rid of that to adopt new systems. Windows 10 is going to be a nightmare for a lot of trusts because we are in some ways earlier in our adoption journey in social care. We're not lumbered with a lot of legacy tech. Also, because we don't have the same kind of procurement and contracting mechanisms as the NHS, it's sometimes a little bit easier for our organisations to move in that way and get what they need in. But we just cannot keep having this conversation about AI, this conversation about sensors, about all of the various things that are possible, unless connectivity, data security, and really basic digital skills are addressed. And we talked about digital skills a few weeks ago. We know that digital skills is in a much better place than it's ever been, but there's still so much to do.
Absolutely. And yeah, we talked about the fact, it's a bit of a myth that care staff apparently don't know how to use a smartphone. Obviously, there are some people who are digitally excluded, but the vast majority are using them. But if you are still, working in a converted residential Victorian home, residential care home, which has got really thick walls, it's really hard to retrofit routers into it so that you actually can have good connectivity throughout. Or if you're in an area where there's still not been a fiber broadband rollout, you're still working off old school like copper cabling, you could have the most high-tech swish piece of equipment in your hand, but it's not going to connect to the equipment. You're not going to be able to put full sensors into that room without quite a lot of infrastructure upgrade costs still. And same for domiciliary care. There is still sort of data black spots across the country. I think I've mentioned before, living in Shropshire, I am very aware that 4 and 5G data is but a dream in some places. So, I think there is a lot more that needs to happen around getting the basics right at the end of the day.
And I guess joining up the ambition
Mm.
at the front with the commitment to the basics. That's the bit that I would like to see. And that's really where, policy can be really influential. But unfortunately, so much of our policy is siloed that the bit that's promising AI revolution is not connected to the bit that's checking whether we've got really basic connectivity and Katie can join Teams calls when it's raining.
Yeah. No, I have broadband now. It's so exciting. Fiber finally to the property. I can never move. I can't move to a different place in the town.
Well, my next story is on the same vein, although I'm really pleased to see it is from my neck of the woods.
Mm-hmm.
And this is about a digital wounds app. So Cheshire and Wirral partnership piloted, and I will come back to this point about pilots, an app specifically for checking wounds and wounds healing. So previously, individual staff members would need to take a measurement, and then when they come back in 2 weeks, they measure it again and see whether the wounds is healing, shrinking, changing, or whatever. This app allows clinicians to use a smartphone to scan the wound, and then the AI within the app assesses the image, details progress, and helps to determine if the wound is the same as before or if it's getting better. And the results so far have been really, really promising. Jenny Kirkham, who is the project manager for Cheshire and Wirral Partnership, said before we would have had to rely on clinical staff taking their own measurements. They would have had to record it in a system. With this app, the measurements of the wounds, it's standardized. The amount of admin required by staff is reduced, allowing them to spend more time providing care, which is time and time again the thing that you and I are always dreaming of for tech. Tech is not the point, but does it allow us to do more with the person, deliver more care? And, from a social care point of view, this is really interesting. We know that delegated healthcare tasks are increasing in the sector. This feels like something that could potentially be accessible because from actual clinical point of view, the assessment is done by a clinician elsewhere. The mechanics of taking a picture of a wound is fairly accessible and rudimentary with some training. Obviously, I had a really good route around and was looking for, what happens to the data if we are taking pictures on phones. What happens? The data, the scan data is transferred through the app, but is not saved anywhere on the phone, which should make people more comfortable. But again, this is a pilot, and we will share the article in the show notes, and you will see that it is an article about pilots and how do we move from this constantly testing in a single place to large scale adoption and kind of rollout. What are those benchmarks? Now, I've worked in the not for profit sector for the past 15 years, and we have always suffered from pilotism. Time and time again, pilot this, pilot that, try it, but never is the money for rolling it out beyond the pilot. It's never identified at the start. And I think we're at real risk with the scale of pilots in tech and digital at the moment, all proven really exciting things with absolutely no route to that wider market and the wider kind of community benefit.
Yeah, absolutely. And I think I actually can't remember if we talked about this in our 10-year plan episode, but there was mention in the 10-year plan about having sort of a pilot passport, I believe it was called. So, where a piece of technology had been piloted and proven as effective, it basically could then be passported out across the rest of the system. It doesn't need to be tested again for exactly the same use case. And I think we need to be doing more of that sort of thing in social care as well. I mean, the constant issue is, where do you keep that information? Where do we share the benefits in a way which is easily accessible and findable by people? How do we compare pilots as well? Like, what evaluation framework do we use? So there's still a lot of questions there, but I do agree. I think where you have pieces of tech like this one, where you can see a really clear benefit use case, how can we make sure that that is used more widely? Because for this in particular, the first thing that occurred to me is like, thinking back to COVID and, my background's working in nursing homes and like hearing from nursing homes who you couldn't have tissue viability nurses coming in to do wound management and wound dressing, and how having something like this as an additional support tool could have been a way about making sure that wound management was still being overseen by a specialist in a way that it just was not possible. And people were doing the absolute best that they could do in a really, really difficult time. But think about how much of a difference something like this could potentially have made to people. So,
Yeah. And I think we will continue having this conversation about pilots because a lot of the news stories that we see are at this point of we've tried something, it's amazing. Like, but so what? If it never rolls out to everybody, if it's never accepted as like kind of standard, then what was the point in all of that? Because there's no point proving the frontier if you don't invite everyone else to visit.
yeah, for sure. So, I then picked an article from Don MacAskill from Scottish Care, who I'm a big fan of, does amazing work over in Scottish Care. And really, it was thinking through ethical technology and care autonomy and person led technology, and what does that mean? And it's really a reflective piece talking about how people, particularly older people, are increasingly feeling a sense of losing control, not really about their healthcare decisions, but over their own information. Who knows what about them? Where is that being shared with? What does it mean? Um, and could quote this whole thing because I think it's just written beautifully. But just a quote from Donald on it is that far too often those personal narratives are sidelined, not intentionally, but gradually, imperceptibly, lost in a sea of forms, eligibility criteria, assessments, and appraisals. We gather data, but lose the person.
He's good. I
He's
mean,
really
he
good.
is for anyone who gets the chance to see Don speak, he is a wonderful speaker, and that is so at the crux of many of the conversations you and I have, Casey, about tech.
Yeah, absolutely. And Donald does also have a podcast, so you can hear him speak these words himself. And I just think it's something increasingly when we're looking at technology, it's really about, how are we making sure that the tech we're using is designed with people, not just for people. We see a lot of software, both of us are approached a lot by software companies who some of them have done incredible co-design work, incredible like user testing, user experience, that sort of thing. But some of them have designed something and it's only at that point that they want to go and test it. So it's like, actually, how do we really think through as care, so in social care sector, the tech that we're using and making sure that it is right for individuals? Something that I always think about in this case is the About Me standard, which is an amazing standard, which is all of the information which is important to a person. It's appended to your care records, your personalized care and support plans, your medical records, has information about, you know, what is, in your own words, most important, but it can't be updated by the person. It requires a care professional to be the person inputting that into the standard at this point. And like, well, if it's about me, I should be the person who gets to do that. So I'm always hopeful, and we talk about this all of the time, that we can make sure that where we're using tech, we're giving that power and control back to people. And I think that's also increasingly going to be a demand from the population demographics we're looking at. And that's something that Donald also points out in his article. Younger people have more sense about the importance of their own data and having control of their data. They're more interested in sort of decentralized ways of holding data, more interested in sort of like personalized data stores. And increasingly, we see people who have a real keen sense about what their data means to them and how they would like it to be used. And as people become more informed in this way, I think that's something we will see more and more in the health and care space as well.
Yeah, and I think that the demographic changing is the really interesting one because
Mm.
ultimately, I think we forget sometimes, and like it is, oh, how do I want my data used? I'm a user of the NHS. At some point, in all likelihood, I'll be a user of social care. If I live long enough, gonna keep checking the roads when I cross over. But we have to have that at the front of our minds. And again, the tech and the digital solutions are not the point. The point is really good care. And I think this ethical conversation is a hard one to have because there are no easy solutions. And also, some of the time, the answer will be it's just not right to do it. Just because we can doesn't mean we should. Um, and I don't know that we are in a system that is mature enough to take that decision. We are far more likely to say we won't do this because we can't afford it than we won't do this because it's not the right thing to do.
Yeah, I absolutely agree. And I know I speak to loads of social care organizations who really have sort of ethical approaches to technology at their sort of heart of what they're doing. They really believe in that personal choice. But if there are organizations who would like to move more into this way but don't necessarily know where to start, Scottish Care have the Digital Human Rights Charter. It's a really, really impressive piece of work. I'm a big, big fan. And I think looking at that as a starting point for how we can think about technology from a human rights approach, the work that Scottish Care have done there is really, really important and really meaningful. It's a great starting framework for anybody who's really wanting to think about ethical use of technology. So can only recommend that.
Thanks, Katie. And then I've got our last piece of news, which is always a nice one. And it's just to tell people about some money that's become available.
Mm.
So there is currently a digital inclusion innovation fund that has been launched by the government. Bear in mind, Lloyd's estimates that around 1.6 million people in the UK are currently living offline, and around a quarter of the UK population have the lowest level of digital capability. So, meaning that they're really likely to struggle using online services. Ironically, that is the group who are most likely to need them for things like welfare benefits and employability support. So, we know that those who can't use digital technologies are likely to have worse health outcomes.
Mhm.
And this fund hopefully will go some way to helping that. So, eligible organizations include combined authorities, local authorities, charities, and research organizations, but they can also partner with other organizations. And they're looking for projects which address at least one of the digital inclusion action plan focus areas. So, opening up opportunities through skills, breaking down barriers to digital services, tackling data and device poverty, and building confidence and support through local delivery. There is £7.2 million available for
Wow,
England.
it's a lot of money.
Um, and there's, proportionate funding available in Scotland, Wales, and Northern Ireland as well. And that money has to be spent by the 31st of March next year. So likelihood is there's quite a good chunk of money for quite short-term projects. Projects shouldn't be ongoing. There are quite strict rules around what you can actually pay for. But if you're an organisation who's interested in the space, massively recommend going and having a little look and seeing if you can apply.
Oh, yeah, definitely, especially when you don't see funding pots like this popping up that often. I went to the market engagement webinar about this as well. They were really encouraging people to do regional and local projects as well, so don't feel like this has to be a big national thing. If there's something you're wanting to do locally, make sure you get an application in before 10th of September.
Fab. So that really brings us to the end of the episode. And before we go, we have what is my favourite segment, which is the Cyber Squirrels. For those of you who are just joining us for the first time, sometimes our episodes can get a bit doomy gloomy. But in our first episode, we touched on a story that one of the biggest cyber risks is actually squirrels eating wires. And I
Hmm.
was like, oh, well, we want more of that. So this is where we make sure that we find something good, something light-hearted, something funny. So I'm going to start with something good and something I'm really happy to see. For anyone who follows the world of investments and tech and startups and everything, most money goes to men. However, in Scotland, a big startup fund for health tech startups, £1 million has just gone to three female-led organisations. So Scotland always has a special place in my heart because I used to live there. But again, leading the way, we've like Scotland are representing really well in this episode today,
Yeah,
Katie.
this is the Scottish episode, apparently.
So yeah, so that was just a little bit of good news. All three businesses invested in. They've got female co-founders and they're developing technology solutions specifically dealing with healthcare challenges. So I love to see it.
It's absolutely amazing. And now I feel bad about having a significantly sillier Cyber Squirrel story. But one I thought was kind of amazing. So, for anybody who missed it, they wrapped up on Sunday. There was the first ever 2025 World Humanoid Robot Games. And I sort of thought this was going to be like Robot Wars, nothing quite that exciting, but they did have humanoid robots playing international football games against each other. So you had teams from China, from the Netherlands, from all over doing like a genuine robot football World Cup sort of style thing. And I just think that that is such a fun way. We talk a lot about sort of the serious side of robotics, but that is really fun to look into.
I mean, that has got Disney Pixar all over it.
Oh my god, the first, like, humanoid robot bobsled team.
Oh my god, I love an underdog story, an underdog sporting story with robots. Someone make it,
Yeah,
please.
somebody from Hollywood, call us. We have lots of ideas.
Our rates are really reasonable.
Very reasonable.
Thank you, Katie. That was brilliant. Um, okay, well, that's us for this week. Come back next week where we'll be discussing all the latest digital news in care. So, what happens when two of the most plugged in people team up to demystify digital care? You get control plus care.
Subscribe now wherever you get your podcasts. All of the articles and radio shows mentioned in today's episode will be in the show notes.
Tell a colleague, especially if they somehow miss the first World Humanoid Robot football game.